So this is case three. This one is from a very close colleague. We are having a conversation and then he told me this. Boy, come see you. Some postpartum eclampsia. Some postpartum eclampsia wey we manage for here. Patient make fine, no seizure recorded, BP well controlled. Relative can say it be spiritual, that they won't go continue the spiritual care. That if no be the spiritual care like by now, she die.
Oh, that's crazy. So what the hospital did, yeah, it didn't add up. It's a spiritual aspect.
You know the funny side of the story? That if you no be the spiritual care, like by now she die.
Father, she died.
The way I bore, I say make them go bring that man. See, this be the funny things. So you can't. Sometimes, I don't blame clients. Do you really blame clients when it comes to this kind of stuff?
Not me partly. I blame them partly. Yes, yes.
What?
Sometimes, okay, me sometimes sometimes what I feel is that education sometimes play a very big factor in it. If they had understood what actually is happening to this person, I believe if they were well educated and they understood what this person is going through, I believe in a way they would have made the hospital carry, or even while the hospital is doing its part, go home and do your spirit, but don't send the client, like, don't ask for dama. Like, you get it. So, me, I sometimes the education plays a role.
It be funny. Ignorance is
Yeah. How can you say this?
the person.
So why? Okay. So it's a postpartum eclampsia, right?
Yeah.
So okay. Well,
Basically, the seizure is making them think it's
it's
spiritual.
spiritual. Yes.
But no, so this is where ignorance comes.
Yeah.
Ignorance. Hey, you see,
It's
these things, see, everything can be medically explained. If you feel somehow that this particular thing is beyond the scope of medicine, I mean, we read the Bible.
sure.
We dey read Bible.
I did read Bible.
You dey remember where God is omnipresent, God is omnipotent. You remember
Yeah,
all
yeah,
of
yeah,
that.
yeah, yeah.
You can be at anywhere and pray for your client.
Sure.
And even pray for the health workers taking care of
Care
your
of.
client.
Yes. Yes.
So that they get to understand what is happening, what is wrong. So that the appropriate thing might be done. We are all human. Sometimes there are some cases we need to go back to our books to read them. So you see case 1, 2, 3, they blame spirits.
Spirit.
What?
Spirit is innocent. The
Because
spirit is
second off,
innocent.
you not see the case before. You haven't seen something
Some
like that
people, yeah.
before. No, you dey blame spirits.
No, but in some
And some of these things, if you want old people,
people, yeah.
ah,
Some people are so like they are too much into spirituality that anything that happens, you see, the other time we're talking about this medical fatalism or something like that. You see,
everything be spirit.
everything
To
be
them.
spirit. Everything
No,
be
you see,
spirit.
blacks and Ankara always with the things say somebody they do.
That's what we see. Like the bad things the things we do in the bad. So anything that happens to you, try to attribute
No,
it to.
if you be wicked, you no go feel have peace of mind.
That's what the Bible
Blacks are
said.
wicked.
Even yes,
So always when they figure somebody they do you.
yes,
No, even
yes.
the devil is innocent. See, like
Sometimes.
almost all the time, if black man they do something that the person also sick, but they feel say somebody they back one, they pinch him somewhere.
Yes.
That shouldn't be there. If you have a sound mind, if you have an open mind, if you're an open-minded person, these things will not.
Yeah.
Just see everything to be normal. You see, it's life. It doesn't have to be straight. There has to be some form of breakages somewhere where you take your time, come back, analyze the situation, and then go back with another force. But if you always think that there is someone doing you, you're always going to go behind because all the force are going to be focused on the person you think is doing. But that's
Yes.
more like an illusion. You are just thinking about something that doesn't exist.
So you see, this and everything most of the time is the mind. Now, if you've told a patient that it's something spiritual, so even the treatment the hospital is going to give, crano,
They are not.
yeah, it won't work. Our mind is everything. So if the mind makes up is like if you make up your mind, okay, this thing is a hospital something. So if I'm in the hands of the health workers, I'll be fine. Now they are saying that this thing is something spiritual. So even the efforts the health workers are going to put in the crano, it wouldn't work.
Because you feel like in your mind,
You like it's something. It's a spiritual
and even
thing.
here, your diagnosis has been established: postpartum eclampsia.
Was it explained to them what
Well,
it is?
that's not the side I want to see. Me, my issue is you even projecting it to that point to say it's spiritual.
You see,
And even the health workers doing their best to control the seizures, control maybe, and saying that if not for the
the
spiritual
spiritual
care.
listen they did. Like the
So the
person is
question
dead.
now is, what type of spiritual care did they actually go for?
Maybe they. Well, no, but who was? So you see so who was?
Is it relative?
It's a relative.
Really, not be the patient too.
You see,
Patient there is suffer. Relative.
so they see anything.
Child.
So you see, it's sometimes it's bad. It's bad. So what did they do? Did they actually did
Well,
they bring?
the end didn't come.
But
We are yet to.
so in cases like this, can the health worker stand in for the patient and ignore the relative sometimes?
Is it the relative is in a position to make, as if the relative, if the patient is in a sound position to make a
Yeah.
decision for him
Yeah,
or himself,
so
that's fine.
yeah, but this
Other than
case,
that, the next person is basically the husband.
yeah,
You get it. That's it. I mean, if they want to, but then if the patient himself is sound, someone has heart failure and things, the person might be confused and all
yeah,
of that. But if the patient is in a sound state to make a decision, I mean, the patient can say, I want to. You get it. It's for kids, you can stand in for them because kids are, I mean, they can grow up and come and say that I don't side with the decision my parents made.
great.
So those ones you can side for them. But for adults, it has to be sequential.
And this you even go in and the relative cry is a foul. It's a foul. It's not even a
Then
close
another
relative.
thing, maybe
Baby, like something
but the
spiritual.
spirit in the head, no, when the girl was, then they come.
Then they come back.
They want you to perform
By
magic.
then the person has deteriorated and to the last
And they're
degree.
expecting magic.
Magic.
There's this thing I'll talk about eventually, but it was just a case around 1 to 2 a.m. These parents brought a child to the hospital. But according to them, child had vomited persistently and then had watery stools, very persistent. So more like she had passed like more than 10 times of watery
Oh,
stools, then vomited about 10 times. Child came very weak, lethargic. So they keep making noise. We had about 3 cases already attended to at the OPD section. So we had no free space. Everyone, and it was a night shift, we don't have much people on
yes.
night shift. And so everyone was at the OPD working. So we're not even writing anything. We're just trying to sort out
Yes.
the emergency situations that came before we put them on bed and stuff. These people came in, more like we should stop everything and attend to them. So we had to calm them down. And then we attended to this child. So after 1 hour, the child started getting this energy, walking around. The parents came in. The child is what? The child is traveling.
For real.
So the question is, if you came and the child needed oxygen and you had to be on oxygen, would you have told me that the child is traveling, so I should discharge the child of the oxygen? How do you guys do that?
The child is traveling. So you should discharge the child.
And he ended up telling me, this is not the only hospital. We are going and get with you.
So you see, they are killing this child slowly.
I said, fine. And I didn't talk again. I said, okay. Yeah, I'm doing that. He said he can't write.
Oh no.
See, it's funny, right? It's another case we will
It
talk
does
about.
happen, like it does happen.
We will talk about it another time. So stay tuned. Do you have any last words to say? Because this particular case, you need to ever like
No. But you see, sometimes it's very necessary that when health workers we are attending to a case, all relatives should be outside.
that's how it's supposed to be.
Yes. But sometimes some of the private, you see, institutions, you come in whilst you the clinician, you are
When you go
attending
to
to the,
the public sector, they are scared.
they are scared. They
But
are
the private,
scared.
they feel like it's
It's
private.
a
I don't know
private
how much
place.
they feel like they pay.
Yes,
But it's
because
like
it's a private thing.
at 10 p.m. you see people visiting their
Yeah.
relatives.
So me, I think sometimes these things can be minimized or or can be prevented if the relatives like
Yeah.
aren't part of like during the management they are not there. I think you see so you
The
see
private sector also feels like if you believe that they are losing clients.
no, but you see we need to explain to them. Oh, wait for us outside. We are trying our best.
Do you think they will?
They would. Oh no, they would.
Have you tried it?
No,
Facility
me.
before?
You see me.
But I know say some of them no go agree.
Maybe it depends on how you say it. You get it. No, if you don't agree, I'll tell you that if you don't go out, I wouldn't take care of
Uh-huh.
I wouldn't take care of your clients.
You know what? One client relative told me.
No.
If I finish taking care of if I finish doing whatever I'm doing, who will I come to ask to go and pay them that? If I'm allowing to be there,
No.
you go and pay them
So
that.
you
I said then you should come, I'll write a referral for them, then they will
simple. You get it.
and
They are those causing all these confusions. Yeah. So your management will be some way. So it's all part.
Alright, so I think you all heard it. You people thinking about spiritual things every day and fighting your way out.
Sometimes the devil is
Try
innocent.
to calm down.
Sometimes he's
A
innocent.
lot of time the devil is innocent. We now we dey do am. We dey do am then we go blame devil. We now we dey do am.